Testing. Test, test. Testing 1, 2. Test, test. You're good. Test, test. You're good. Perfect. Thank you.
Um, I don't have thank yous in here. Oh, yeah, I do, right here. Okay. Okay. Am I on? Good. Good afternoon, everyone. Thank you so much for taking time to join us today so that we can highlight the importance of getting the updated COVID-19 and flu vaccines that are now available for everyone who lives and works in LA County. I want to take a moment to start with some big thank yous. First, can we just thank everybody who's here to get vaccinated? Yay! We're so proud of you. We're so proud you made time to come. We think it's really important, obviously. I'll be joining you today in getting vaccinated because I know it's important. But we're really thrilled to have you. I also want to go ahead and thank the vaccine teams that are here. Just join me thanking the people who are signing you up, getting you vaccinated. These public health teams go everywhere in LA, vaccinating people, offering them good information. Note that we also have COVID test kits that we can give you free of charge. So if you do get sick or someone in your family gets sick, you have easy access to testing to see whether or not you actually have COVID. I want to have some very special thanks to Sabrina Junkin. I don't know if she's here. Where's Sabrina? Yay, Sabrina. I hope she comes in just for a minute so we can all thank her. And all the residents and all the staff that are at the Weingart Senior Center for their hospitality and support, which made today's event possible. Without Sabrina and her team, we couldn't be here. So yes, Sabrina, yeah, she's coming, so. Hey. Thank you, Sabrina. So we're so grateful. So yeah, I was just saying we couldn't do this without you. So you guys are amazing. So yeah, well, you know, it takes special people, and you're one of those very special people. So joining me today is also Dr. Ugana, who's the medical director for Vaccine Preventable Disease Control Program at LA County, and Gema Morales-Meyer, our director of clinic services, and she will share remarks in Spanish. We'll all be available to answer questions. Dr. Kim is here also. She is the director of Vaccine Preventable Disease Control. So we have a lot of people to answer questions for both the residents that are getting vaccinated, but also for any of the media that's here. I want to share a little bit of important information about the updated COVID-19 and flu vaccines. I want to talk about where residents can go to get vaccinated. I'm going to get vaccinated, as I noted myself. And I want to make sure that everyone is aware that it's still important to take advantage of the protection that's offered by an updated COVID-19 vaccine, because we are headed into respiratory virus season. These updated vaccines are different than the vaccines we got last year and earlier in the spring for those people who vaccinated before September. They're formulated to closely target the virus strains that are currently circulating and causing the most infections. And this will help us get the additional protection against the serious consequences of COVID-19. And the same thing for flu. The flu vaccine, it's a new vaccine every year, formulated to really take advantage of being up to date on offering the most protection that we can get. Because the COVID-19 virus changes over time, it is important to get an updated dose that's formulated to offer the better protections. I know many of us are tired. A lot of people in this room probably been vaccinated 5, 6 times, and they're wondering, when can this end? But like flu, this is likely to be an annual vaccine that we're going to get every year. And it's important because although many of us have some immunity from all of the previous vaccines, and many of us also at some point may have gotten sick with COVID, that protection we get from either vaccines or having been infected, it does diminish over time. And getting vaccinated with an updated vaccine does provide you some additional protection against severe illness. Although the hospitalization rates and our death rates are currently very low, for the 90-day period that ended at the beginning of September, I just want to remind us all, unvaccinated residents were 4 times more likely to be hospitalized than vaccinated residents. And certain groups of people are obviously more vulnerable for severe illness from COVID-19. And this continues to be true, especially for people like me who are older. Since the start of the COVID-19 pandemic in March of 2020, LA County residents 65 and older have consistently had higher rates of hospitalization and death due to COVID-19 when compared to residents who are under 65. The COVID hospitalization rate among people 65 and older is 6 times higher than it was for people under 65. Of the 60,000 plus COVID-associated deaths among residents since March of 2020, 73%, most of the deaths were among people who are 65 and older. The cumulative death rate among residents 65 and older is 18 times higher than it is for people who are under 65. So while the vaccine benefits everyone, and I don't want anyone to misread me, benefits everyone, no matter who you look at, vaccinated people have less severe illness and are less likely to die than unvaccinated people. Those at highest risk for more severe illness, including people 65 and older, should take advantage of the easy access that we're offering for the updated COVID-19 vaccine. And because the fall is also a time where other serious respiratory viruses circulate, public health is encouraging residents to obtain updated 24-25 flu vaccine for added protection against severe illness associated with flu. In Los Angeles County, over the course of last year's flu season, 23-24 season, there were over 5,000 people who were hospitalized because they were sick with influenza illness. And there were 124 people who we know died of flu. Again, we can prevent a lot of the serious illness associated with flu by getting the updated vaccines. Influenza vaccines have been shown for decades now, really, to prevent complications and severe outcomes that are associated with influenza. This includes illness, hospitalization, and death. So we're pleased to be here today. We're pleased to be here with these wonderful residents taking advantage of adding protection as we head into the respiratory virus system. This not only helps all of us, but it also keeps our hospital and healthcare system from getting overwhelmed by people with serious illness. Any resident who wants to get vaccinated with the updated 24-25 COVID-19 and flu vaccine will be able to do that regardless of insurance or immigration status. Our updated vaccines are available at pharmacies, clinics, and healthcare facilities. Residents with insurance can...
Regulatory bodies like the Food and Drug Administration and the Center for Disease Control and Protection ensure that only the safest vaccines reach the public. Additionally, after every vaccine is approved, vaccines are continuously monitored for safety. To date, with these 2 vaccines, serious side effects are rare and the benefits far outweigh those risks. Now I'll talk a little bit about how these vaccines are updated each year to improve effectiveness. Like Dr. Ferrer mentioned, both influenza and SARS-CoV-2 viruses continue to change, so it's important to get the updated vaccine that's formulated to offer protection against the new strains of the viruses that are currently circulating, the ones that are currently causing disease today. So every summer, global and national surveillance systems track the various variants of both SARS-CoV-2 and influenza to inform vaccine composition. The data are reviewed by the FDA, and then the FDA makes a recommendation to produce an updated vaccine that protects against these specific strains. Those vaccines are then made available in the fall to be used. Additionally, protection can wane with time, So although flu and COVID-19 activity right now is not high, we expect that we'll see surges in both of these viruses during the late fall and winter. It's important to get vaccinated now to optimize your protection during respiratory season. This means that even if you got a vaccine this summer or you got COVID-19 infection recently, you should still get that updated vaccine today. The vaccines are effective, but they're not perfect. You may still get COVID-19 or flu, but the vaccines help decrease the severity of your illness. Last year, people who were vaccinated against the flu were about 30 to 45% less likely to be hospitalized because of flu illness or related complications. For COVID-19, people who received the updated vaccine were 50% less likely to get hospitalized or go to the emergency room compared to people who did not get the updated vaccine. If you're at high risk for severe infection, including older adults or those who are immunocompromised, please contact your doctor if you think you're infected with either infection. There are treatment options available for both vaccinated and unvaccinated individuals, and these treatments are most effective if they're given early in the course of illness. Just to review the recommendations, the CDC does recommend that everyone 6 months of age and older receive the updated flu vaccine. Children 6 months to 8 years of age require 2 doses of the flu vaccine, administered a minimum of 4 weeks apart during their first season of vaccination. Adults over 65 should get the high-dose recombinant or adjuvanted flu vaccine for improved protection. For COVID-19, the CDC recommends that all persons 5 years of age and older should get 1 dose of COVID-19 vaccine, and then children 6 months to 5 years of age who've never been vaccinated against COVID-19 should receive either 2 Moderna doses or 3 Pfizer doses. Those who are moderately or severely immunocompromised should speak to their doctor about getting additional doses, as well as potentially an antibody pre-exposure prophylaxis. Finally, COVID and flu vaccines are really important during pregnancy. If you are able to get these vaccines during pregnancy, it not only helps protect you, but it also helps protect your infant from COVID-19 and influenza after birth when they're too young to be vaccinated. For all these reasons, we urge everyone in LA County to make a plan for you and your family to get the updated COVID-19 and flu vaccines today and to obtain the best protection against severe illness ahead of the respiratory virus season. And now I'll turn it back to Dr. Ferrer. Oh, I'll hand it to Dr. Morales-Meyer.
Buenas tardes a todos. Yo soy Gemma Morales, directora de Servicios Clínicos para el Departamento de Salud Pública del Condado de Los Ángeles. Gracias por acompañarnos hoy y mientras hablamos sobre la importancia de obtener las vacunas contra el COVID-19 y la influenza o flu, que ahora está disponibles para todas las personas del Condado de Los Ángeles. Primero, quiero tomar un momento para expresar mis sinceros agradecimientos a Sabrina Junkin, que vimos desde hoy, y a los residentes y al personal del Weingard Senior Center por su hospitalidad y apoyo que hicieron posible el evento de hoy. Sabemos que las vacunas son seguras y han tenido pruebas rigurosas antes de ser aprobadas. Las vacunas este año han sido formuladas para atacar las cepas de virus que están circulando y que causan la mayoría de las infecciones. Estas vacunas ofrecen mejor protección contra las graves consecuencias del COVID y la influenza, incluyendo las hospitalizaciones y la muerte. El otoño es la temporada cuando circulan virus respiratorios graves como COVID y influenza. Salud Pública recomienda que las personas obtengan una vacuna contra la flu del 24-25 y una vacuna de COVID del año 24-25 para mayor protección contra las graves consecuencias de estas enfermedades. Debido a que los virus de COVID y flu cambian con el tiempo, es importante obtener la vacuna cada año para ofrecer una mejor protección. Todas las personas mayores de 6 meses son elegibles para recibir la vacuna contra el COVID y la gripe. Aunque nuestros casos de hospitalizaciones y mortalidad son actualmente bajas para COVID, Durante el periodo de 90 días que finalizó el 10 de septiembre del 2024, las personas que no estaban vacunadas contra COVID eran 4 veces más probables ser hospitalizados que las personas vacunadas. También hemos visto que ciertos grupos de personas son más vulnerables a enfermedades gravemente por COVID y esto sigue siendo cierto, especialmente para las personas de la tercera edad. Los casos de hospitalización de COVID entre personas de 65 años o mayor fueron 6 veces mayor que los casos de hospitalizaciones en personas menores de 65 años. Y eso resultó en 77, de todas las muertes desde el marzo del 2020, 73% ocurren en las personas de 65 años o mayores. Para influenza en el condado de Los Ángeles, durante el transcurso de la temporada del año pasado, hubieron más de 5,000 hospitalizaciones por influenza y 124 muertes asociadas con la flu. La vacuna nos beneficia a todos, pero es especialmente importante que aquellos con mayor riesgo de sufrir una enfermedad grave aprovechen la oportunidad de tener la vacuna de COVID y de flu. Vacunándose es un modo de tomar medidas para protegerse contra la enfermedad grave de COVID y flu. Ahora que empieza esta temporada de virus respiratorios, no solo nos protege unos a nosotros, sino que también ayuda a evitar que el sistema de atención médico se vea agobiado. Las vacunas contra el COVID y la gripe ahora están ampliamente disponibles en las farmacias, clínicas y centros de atención médica, lo que hace que sea conveniente para las personas vacunarse. Y también recomendamos, y porque también es seguro, ponerse las 2 vacunas al mismo tiempo. Las personas con seguro médico pueden obtener vacunas contra el COVID y la flu a través de su proveedor de atención médica o en muchas farmacias participantes. Hay vacunas gratuitas disponibles para los adultos sin seguro o con seguro insuficiente. Hay vacunas gratuitas disponibles para adultos sin seguro o con seguro insuficiente en muchos proveedores de atención médica y centros de salud a través del programa de Bridge Access de California. Cualquier persona que desee vacunarse con una vacuna contra la gripe y el COVID para este año podrá hacerlo independientemente de su estado migratorio o si no tienen seguro médico. Hasta agotar existencia, Salud Pública también tendrá vacunas contra el COVID y la flu por gratis para el cliente, a través de nuestras clínicas de salud pública de vacunación de servicios múltiples en Ted Watkins Memorial Park y también en Obregon Park. Nuestros equipos móviles, así como el que ve ahora, también están disponibles para organizar clínicas de vacunación en lugares de trabajo, eventos comunitarios, centros para personas mayores, iglesias y otros lugares en todo el condado. Como recordatorio, para obtener información adicional sobre la seguridad de las vacunas, cualquier persona que tenga preguntas necesita ayuda con las citas o no pueda salir de su hogar y necesite vacunarse, puede comunicarse con la línea de información de salud pública que está abierta los 7 días de la semana. El número es 1-833-540-0473. Gracias y ahora contestaremos algunas de las preguntas.
Muchas gracias, Gemma. Thank you all. We can take a few minutes of questions if you have any. Otherwise, I'm going to go get vaccinated and we can talk offline if you want to. I have 2 amazing doctors here that can answer questions. So. Everyone 6 months and older should be getting vaccinated this fall. Thank you. Okay.